Good afternoon, everyone. Nice that you could join us today. This is our CBAS Updates quarterly webinar with the California Department of Aging, Community-Based Adult Services. My name is Jill Sparrow, and I'll be hosting our webinar today. Glad that all of you could join us. We have about approximately 400 people registered today. And I see the attendee list, the numbers are climbing. So I'm going to just give us a moment to make sure that everybody is logged in and joined before I proceed further. So I'm just going to pause just for a few moments here. Okay, we'll continue. Again, my name is Jill Sparrow. I am the CBAS Bureau Chief for the Field Operations team in the CBAS Bureau. We have, like I said, about 450 people joining us for the webinar today. Those include primarily our CBAS providers around the state, and I know we're also joined by several of our managed care plan partners as well. We also may have some of our colleagues at the Department of Healthcare Services in the audience today. So thank you all for joining us. We will be making the PowerPoint available to all of the attendees after today's webinar. So keep a lookout for that. We'll be emailing that out to all who have registered, and likely we'll be emailing it out as well just to our administrator and program director list that we maintain. Okay. We will be taking questions today. We know oftentimes many of you come with many questions, so I'm glad that you do. We're going to try to answer those questions for you today, get to as many as we can. We do have the question box. If you take a look on your screen, there's a question box, so please submit your questions through that, and we'll try to answer questions as we go along this afternoon, and also we'll save some time at the end of today's webinar to answer questions. The webinar is being recorded, and we will be posting that on our website following the webinar today. Again, if you have colleagues, staff who may not be able to attend the webinar today, we encourage you to have them listen in at a later date once it's posted to the website. Okay, so what we're going to be covering today. Introductions to, in addition to myself, I also have joining me today is Jennifer Jager, who is our other CBAS Bureau Chief over our Field and Policy Support team. I also have Denise Peach joining us, who is, of course, our retired CBAS, former CBAS branch chief. So the three of us will be talking with you today. And behind the scenes, we have Lynn Benjamin, who's going to be keeping an eye on some of the questions for us as well. So we're here and we'll get started. So what we're going to cover today, we want to cover some CBAS news, give you a little sense of what's been happening in the department a little bit at CDA, and also what's been happening with our CBAS Bureau. We'll talk a little bit about new guidance that's been released over the last several weeks that pertains to ADHD CBAS providers, including guidance from the Department of Public Health and other entities. Also be covering other key guidance reminders as well that we feel are important to keep in mind. We'll be moving on then to talking a little bit about the upcoming CDA All Center letter that is currently under development. We wanted to give you a kind of a preview of that and what to expect. And then a little bit about what's going on, what's happening with ongoing vision team activities. We'll provide a list of references, of resources, and of course, answer as many questions as we can get to. Okay, so let's get started. First, just wanted to make everyone aware of some new CDA staff that have joined our department. The first one is Sutep Lahavanich. And Sutep has joined us as CDA's Deputy Director for the Home and Community Living Division. He just recently joined us this month, and we are thrilled to have him join the CDA team. Chantel Bush has also recently joined us as Chief of the Health at Home branch. And I should mention too that so Sutep and Chantel, Sutep will, as the Deputy Director for the Home Community Living Division, is responsible for the oversight of the Older Americans Act programs at the department, as well as the home and community-based service programs, which include the Multi-Purpose Senior Services Program, MSSP, the Health Insurance Counseling and Advocacy Program, HICAP, the Aging and Disability Resource Connections, ADRC, and as well as CBAS. And then Chantel, who is working directly under Sutep, will is responsible for the home and community-based services programs, MSSP, ADRC, and CBAS. So Chantel is my direct supervisor. So I just want to kind of give you a little bit of kind of a layout of the land there and a little sense of kind of the organization at CDA. So that what you see is very kind of abbreviated org chart right there, very, very simplified, but just want to, again, give you a sense of our new leadership that's come on board. Okay, some other news, just wanted to make all of you aware that CDA is going to be moving. In addition to many of the other things that we've got going on, we thought, hey, a move would be great this year. So we are going to be moving. We are very excited about that. And that is upcoming in September or October. So very, very shortly, plans are underway for that move. You'll see our address on your screen of our new location, not very far from where we currently are housed. But just we will be providing some additional information, contact information, and instructions just in terms of in case sending correspondence. For the time being, please just continue to send any correspondence that you might need to our current address on National Drive. So we will follow up at a later date with any changes that might be necessary there. So, but just want to give you a heads up that the CDA is on the move. All right, also, we just wanted to let all of you know today just about some changes within our CBAS Bureau. It says new team members, but really not quite new. Ivan Jaramillo is actually, many of you know him as our one of our plan of correction coordinators. Ivan recently accepted a promotion as manager in our CBAS field and policy support team. So congratulations to Ivan. He will be working on the same team that he was as our plan of correction coordinator and working directly with Jennifer Jager, the bureau chief for that team. And this team is responsible for initial certifications, certification renewal and change applications, the quality assurance and plan of correction, and data collection and reporting. So just want to give you a heads up on that. Again, questions certainly can, about any of those areas. Happy to, I know Ivan and Jennifer are happy, and their team are happy to help you with any of those. Just real quickly, just an update, just where things are these days with number of CBAS centers and initial certifications. You'll see we have 269 open centers right now. So we are continuing to grow, and we have 32 initial applications that are currently at various stages of the review process. So we've got the applications continue to roll in. We're continuing to process the pre-screening packages and anticipate more centers coming on board over the next several months. The next item there just wanted to update you on the 1115 waiver renewal. That renewal package, DHCS did send that package over to CMS earlier this summer, and it was posted on the CMS website for public comment in July and in August. You see that public comment period just ended. So the waiver renewal process is still underway, and we'll be providing you more updates as things progress with that. Plans for on-site surveys, just update you. I think we mentioned before in our previous webinar that we held earlier this summer, late spring. The Bureau is looking at resuming on-site surveys for the 21-22 survey seasons starting this fall. We had been looking and we have been planning for a return to on-site surveys starting in October. And we are still planning for that. However, we know with many changing conditions on the ground in the centers, and these days with the Delta variant and other variables, we are continuing to evaluate that plan, and we may be making changes. We may be delaying return to on-site surveys, but we will keep you updated and we'll let you know. At this point in time, we're still planning for October to resume those, but again, things have been changing very quickly these days. So that may be something that we will postpone as well. So more information to come on those. I'm just pausing for a moment too. I see some questions coming in, so I just want to make sure we're okay. Okay. All right, I'm going to move on. Just the last item on the list here today has to do with the CBAS plan of correction. If those of you who participated in the previous quarterly webinar that we hosted, Ivan Jaramillo did a short presentation on the plan of correction process, and he and his counterpart Whitney Hart have developed a webinar training that will soon be posted to our training tab on our website. And so we hope to be a really useful resource for you, for perhaps new staff coming on board, to train them about the plan of correction process, what to expect, kind of what CDA is looking for, how the process works. So keep an eye out for that. The link there you see where it says posting soon, that is a live link. So again, when we send out this PowerPoint, you'll be able to access that training there if you're not sure where to find it on our website. So keep a lookout. Again, that will be coming out soon. Okay, let's move on to what's been happening with the new center guidance and requirements. I'd say things have been a little busy lately with new orders and new guidance coming out, just a little. So definitely a lot of information coming at us these days. And I know just the challenge of everyone's just trying to get their head around it. So just to kind of start off by saying, the new information that's coming out, CBA, we have and will continue to make sure that we forward you all relevant guidance via emails, so that to make you aware of that. And we also will issue formal all center letters notifying you of that guidance. So again, we're just trying to make sure that to keep everybody aware of the frequent updates to the guidance that are being issued, whether that's from the Department of Public Health or our other partners, the Department of Healthcare Services, wherever that may be. So on your screen today, I just wanted to bring your attention to some of the public health orders that have been issued recently. Many of you are aware of these. Some of you may not be, based on some questions that we've been getting that have been coming in to the Bureau. So thought it'd be important, again, just to review and just to draw your attention to the information you see on the slides here. This is language taken directly from the public health orders. So no interpretation on CBA's part, but again, just taken directly from the public health orders. And encourage you all, if you haven't read through the full public health order, please do so. Lots of information in there. But there was a public health order issued on July 26th. That is the first one that I want to talk about today. And it outlined a few different requirements for healthcare workers, which includes our adult day healthcare CVAS providers. It does require COVID diagnostic testing for unvaccinated or incompletely vaccinated workers in adult day healthcare centers, as well as other healthcare facilities. It also requires verification by the facilities, by the centers, of the vaccine status of all the workers in that facility. So weekly testing at a minimum is required of all unvaccinated and incompletely vaccinated workers, and there are no exemptions to these testing requirements. It does indicate that facilities should have a plan or must have a plan in place for tracking the vaccination status and the test results of this. So, and a deadline of August 23rd was issued for facilities to be in full compliance with this order. So again, there's some active links in here to those orders. The link on the bottom you'll see there is a link to an all facilities letter, which speaks to testing and vaccination and verification of healthcare personnel at these health facilities. So lots of information contained in those. CDA also sent out an All Center letter 2108 that's notifying our providers of this July 26th order. All right, in addition to that one, we have, of course, they're coming fast and furious there. August 5th, another public health order came out, which had to do with healthcare worker vaccine requirements. And, excuse me, so this order on August 5th did require all healthcare workers at specified healthcare facilities, which includes adult day healthcare centers, to have their first dose of the 1-dose vaccine or their second dose of a 2-dose vaccine regimen by September 30th. It also stated that workers may be exempt from these vaccination requirements based on religious beliefs or qualifying medical reasons, but that unvaccinated exempt workers must be tested for COVID, either with antigen or PCR test, and are required to wear a mask respirator while in the healthcare facility. So again, refer to the order for more details on that testing frequency and the mask requirements. We also have some resources at the end too, that regarding masking and such. The order does also state that employers must maintain records of workers' vaccination or exemption status and testing results. And typically, in the past, along these similar lines, CDA has always required providers to keep record of these various things and have them on hand if we were to request them at any time to verify. So good to keep organized records of these, the vaccination status and the testing results for those. And again, this order from August 5th to give a deadline to comply by September 30th. And also clearly stated that the July 26th public health order also continued to apply. And CDA on August 13th just recently issued that ACL 2109, which just notifying providers of that public health order. So we know a lot of information has been coming at you, a lot of emails, a lot of notifications, and I know, of course, definitely challenging to work through that and start planning for how to come into compliance with these requirements. We know also too that there's certainly a lot of questions. We've seen that over the past couple of weeks, questions coming in related to these public health orders. There was the ALE web talk yesterday. Dr. Siegel from the Department of Public Health spoke about some of the public health orders and requirements for these facilities, and did a great job of really speaking to that and to many of the questions that were raised on the ALE web talk yesterday. So I would encourage you all, if you didn't have a chance to listen to that ALE web talk, I'd encourage you to go to the CADS website and listen to it. A lot of good information was provided there. So we know too that many questions might come up today. Certainly, I think I've seen a few come in already, and many questions pertaining to these public health orders that have been issued. So we'll do our best to address them. Just ask that you keep in mind too that many of the questions we may not just have the answers for, or really the questions may be with the purview of the experts at the Department of Public Health. And that, if we aren't able to answer those, we certainly will be directing them and passing those along to our colleagues over at the Department of Public Health. Okay, so just a few other key guidance and reminders. And this is just, if has to do with CalOSHA, the California Department Public Health, CalOSHA, the California Division of Occupational Safety and Health. Just want to make you aware of that. Their emergency temporary standards were updated in June, and providers are required to adhere to what is outlined in those standards, as well as adhering to implementing the COVID-19 model prevention program that you'll see links to there on your screen. These also directly pertain to the CBAS Congregate Center Services Checklist that all of you, as a condition of opening for in-center services, providing services in your center, all providers are required to complete the CBAS Congregate Center Services Checklist and submit that to CDA. And much of that CDA 7027 form contained references to CalOSHA requirements and standards. So again, just want to bring this to your attention to be familiar with all of that. Again, please let us know if you have any questions on that. So, and we know since the public health order came out regarding testing of health workers in the adult day healthcare centers, many questions about, well, how do we get this? How do we test? Where do we get the resources for the testing? So one resource is this, there is a state testing program available through Department of Public Health, California COVID-19 Testing Task Force. And this task force trains interested healthcare personnel, healthcare providers to provide the antigen and confirmatory PCR testing, and then do provide all materials and supplies. There is no cost through this program to providers or the persons tested. And you'll see on your screen, there are links to the email contact information if you're interested and want to get started and participate in that state-sponsored program, or if you just have further questions about it. CDA hosted or worked with Department of Public Health to arrange an informational webinar last week, August 10th, and we had staff from the COVID-19 testing task force provide some information about this program. So if you would like more information, it's certainly not required to use this program, but it is there as a resource to all of you. So please don't hesitate to follow up with them if you do have some more questions. And I know many providers have already reached out and have started the process with the testing task force to get training and get testing supplies, et cetera. Okay. So this directly relates to the public health order of July 26, which requires testing of healthcare workers in that setting. Okay, so here I am going to turn it over to my colleague Jennifer, and she's going to talk to you a little bit about this MSSR.
Good afternoon, everyone, and thank you for joining us here today. I just wanted to provide a quick reminder for providers. So the monthly statistical summary report, otherwise known as MSSR data, had some issues this month for July data as well as June data. So CDA is requesting your assistance to verify and update the MSSR reporting data for both June and July of 2021. It looks like many providers inadvertently entered attendance attendance data into the Medi-Cal fee-for-service section when it was originally intended for the Medi-Cal managed care information or data. So we did send an email to providers, all the CBAS providers, on Monday, August 16th to notify you of this and also request that you verify your data. So we are asking if you could please log into the Peach provider portal and verify that the data for both June and July 2021 is accurate and correct. And if you could try to complete this by Monday, August 23rd, that would be great. It is quite a few. It was almost about half of the providers. So we do apologize for any inconvenience this may have caused you guys, and hopefully we can get this rectified soon, as long as everyone verifies their data. So that would be extremely helpful, and we appreciate your cooperation. If you do have any questions, please feel free to reach out to your CBAS analyst, and they can assist you further. So, and I think that's it for me. Thank you so much.
Thanks, Jen. Yeah, as Jen was saying, this is kind of an unusual. We've never really had this issue happen with our MSSR reports with the data, but we know recently we had a change in Peach where providers input their data and the fields were just switched. They had just been changed. So I think out of habit, many providers were just kind of entering data in the top box when it should have been actually entered in the other one. So yes, please go back in as Jen had requested and check your data to make sure that it is correct and entered accurately. We'll move this along here. So just some other reminders. We can't escape the news these days, it seems. So I think everyone is well aware that we are well into fire season here in California. And it's a good reminder to all of us, to providers, please make sure that there are requirements that ADHCs have a disaster plan on file and are ready to respond to disasters occurring within the center or within or your locality. And this could include wildfires or floods or earthquakes. ACL 1901, which is on our CDA website, provides information about the disaster plan and the requirements and what needs to be included in that. So if you're uncertain or new to CBAS, or you haven't not quite sure what this disaster plan, what the requirements are, please go check out ACL 1901 for some more information on that. In addition, in the disaster plan, just a reminder that all providers need to submit an incident report for any unusual occurrences in the environment or the facility within 24 hours of the occurrence. And that, again, those reporting requirements, you see a link there that will take you to our website that outlines what those reporting requirements are. So we hope no one ever has to use that or submit an incident report pertaining to that, but just keep in mind that that would be required. Like last year, many of you may remember during the fire season, CBAS Bureau, we were sending out almost, I think, weekly a survey monkey to all of you, asking you to respond if you were experiencing any impacts to your center participants from the wildfires. So we are going to be doing that again this year. Please keep an eye out for an email, a survey monkey that will be coming to your email inbox soon. I'm not sure if that's going to be weekly or not, but on a probably fairly regular basis, we're going to be reaching out to you again to ask if you're currently being impacted by any of the wildfires. In addition to the wildfires, we're also being asked to collect information from providers about any possible impacts of the drought, since we know that is also a major issue within the state of California this year as well. So the state does collect. Why we are asking is because the state is collecting information on how the various programs and services and the participants that these programs serve, how they're being affected around the state by the wildfires, drought, etc. So appreciate, just say thank you ahead of time for paying attention to those emails and responding to that survey when it comes through. And again, if really only we're asking you to respond if you are currently being impacted in some way. Okay, I'm going to just pause right there, take a look at some questions to see if there's anything we can answer before we move on to the next section. Okay, and I see we've been answering some as we've gone along, so thank you. All right. Okay. One question was asked, if a center was involved in a remote survey this year, will we also receive an on-site survey this year? So our survey schedule hasn't changed. Every provider we're required to do an on-site survey every 2 years. That's in line with the provider's recertification. So each provider is recertified every 2 years. That's when we conduct our survey. So if you were surveyed, if your CDA conducted a telesurvey this past year, likely you were recertified, and you won't be due for another survey, whether that's telesurvey or on-site, until your recertification is up for renewal again. All right. All right, looks like a lot more questions. I think we're gonna, a lot of testing questions. Oh, someone asked, does CBAS have an updated fax number for the incident reports? We've tried to send many, but they always come back with a busy signal. So the best way, when we've been instructing providers over this last year, is please upload those incident reports through the Peach Provider Portal. And if you have some questions on how to do that, I mean, similar to uploading other documents to the Peach Provider Portal, that is really the best way to get those incident reports to us at this time because of our limited presence in the office right now. So please submit any incident reports through the Peach Provider Portal, just as you would other documents. Someone says they're having difficulty accessing the Peach Provider Portal. If you are, again, please contact your analyst at CDA, and we will definitely help you out with that and try to get some, make sure that you're able to access it. And someone was just asking about the SurveyMonkey that I mentioned regarding possible impacts to providers from the wildfires or drought, and do we only need to respond if your center participants have been impacted? That is correct. You know, we're only asking you to respond if there have been some impacts to your center or participants from those wildfires. Okay. So this time I am going to hand it over to my colleague Denise Peach, and she's going to take us through some discussion about the upcoming All Center letter.
Thanks, Jill. And I just want to make it clear to everybody that I had nothing to do with naming that portal. I always still feel startled when I hear you guys talking about the Peach portal. So that was some wise guy after I left. So at any rate, happy to be here with all of you today to talk about the upcoming All Center letter that we've been working on at CDA. and to basically make good on our promise when we issued all center letter 2104 back in April. We assured you that we were going to give more guidance as we thought it was needed as we approached some of our deadlines on the timeline for the phase transition. So making good on that promise, we're working on getting that out now. Jill promised yesterday on the ALE Web Talk that's what we were working on. So we're going to talk a little bit about that today. We're going to preview it. So yeah, next slide, Jill. Whoever's running the slides. Okay, so what we can share today. First of all, I want to emphasize again that this letter has not received final approval yet. However, we want to make sure that we're addressing some concerns that we know are really pending out there with all of you right now, given the situation on the ground with the changes in the pandemic. So what we can share today is that we have this this letter. It's moving for approval. It's updating, as I say, the timeline and providing various other updates to 2104, our letter that we issued back in April to talk about what was planned for the transition to in-center services and that safe and orderly transition that we've been talking about all along. So what we can tell you today is that it's in the final stages of review. We can't say when it's going to be released, but it will be coming soon. But we're going to give you a preview of some of the punchlines today. You know, again, we feel like we have to address, it's our obligation to address the current state of the public health emergency and the need to make some adjustments and to provide you some updates, heads up about some of the things that we anticipate are coming along down the pike as we hope and plan on getting out of this public health emergency at some point. Next slide. So some preliminary details. Again, I'm going to say this a lot, that we've not yet received a formal approval yet for this all center letter. So this is preliminary, but again, the headline here is that the all center letter postpones until further notice the October 31, 2021 deadline. The deadline that is for the transition of all participants to in-center services at least 1 day per week. So this all center letter that is coming soon is going to postpone that deadline. It provides additional information about planning activities underway and then it will address some changes that we're working on to the allowable remote services, those that will be continued to be delivered through this at the end of the public health emergency and the wind down. Eventually the end of all of the flexibilities that are part of the public health emergency. So before we move on, I want to just take a minute and make sure everybody knows what all of this means. Let me just talk about remote services for a moment. Most of you are very familiar with the task flexibilities that have been allowed at this time are for delivery of services via telehealth and in-person in participants' homes and communities, as well as in the center individually. And then with the changes in April of 2021, we began the progression back to congregate services. So when we talk about the remote services, we're talking about those services that are provided via telehealth, the phone, the video conferencing, the Zooming that you've all been doing, and those provided in participants' homes and or in the community. So to clarify that that these services, as we specified in previous all center letters back in 2020 at the beginning of all of this, and still, these services are to be person-centered and meaningful interventions that assist people at this time. They need to be assessed or evaluated as needed by the center MDT staff, be part of a care plan, address both planned and emergent participant needs, and be documented in the participant's health record, including outcomes related to the services. So, so the plans that we have for getting further guidance out about the continuation of those remote services, which do continue at this time, is that we want to reiterate all of what I just shared about the things that that are the components of those services, the required components, and specify what does not qualify as an allowable remote service. So we feel this is a very important thing to address concerns that our staff have had, some questions and some issues that some of our managed care plan partners have raised, some of the difficulties for all of us, including all of the providers, with capturing things in documentation. So to clarify things, and then to the extent possible, align as much as is relevant with some of the new definitions for enhanced case management that are underway with other initiatives in the state. So we've begun to collaboratively work with others on this, our partners, and we'll be sharing more soon. Next slide, please. So some more thoughts here about the upcoming all center letter. Again, it has not been finalized yet, but we want to make sure that everyone knows that this all center letter that is pending, we think, unless something else slips in here between now and the time we issue this, all center letter 2110 does not do a lot of things. It does not stop the transition to in-center services. What it does is it represents the opportunity to pause, as providers may need it, in different communities with different needs, different centers, different risk levels, et cetera, different progress levels with vaccination. We know we have some centers where all the staff and all the participants are vaccinated, and they have a certain level of confidence with moving forward with congregating, and other centers where that is not the case. So what this all center letter will do is allow this pause if needed, based on the individual needs of individual communities and centers. So again, we recognize that providers have a lot to do right now to comply with the new public health orders. The numerous staffing issues, obtaining of supplies, training, to say nothing about the continuing efforts to get participants vaccinated. So this is what we feel is absolutely necessary to make that possible and alleviate any additional stress providers may have, because again, our goal has always been that safe and orderly transition. For centers who need the pause, you will have the ability to do this. This all center letter will emphasize that flexibility. Next slide, please. So other things to remember here, we want to make sure that everybody is clear that all the requirements that are specified in 2104 continue to apply. I saw some questions come in the question box earlier about this, and I'll come back to that, but full MDTs, assessments, evaluations, IPCs, those continue to apply as they're specified in 2104. What the new all center letter will address is the deadline for all participants to return to in-center services at least 1 day per week by the end of October. That's the only thing that's changed to this phase transition at this point. So again, this is preliminary, but we want to make sure that we are letting you know this today so that we can begin to alleviate a lot of stress that we know is out there at this busy and kind of chaotic time. But that we want to emphasize the continued move to in-center services, and that we want to emphasize again that CBAS, ADHD CBAS is a center-based service, and that we will get back in the centers. And in the meanwhile, as we have these bumps in the road and new requirements, we need providers to continue planning, as we are, for moving back there. We don't know the deadline, what deadlines will be yet to replace that October 31 deadline. But as soon as we know, and that will be, of course, related to any signaling about the end of the public health emergency. And so we will be letting you all know as soon as we have some sense of that that new deadline. I did want to come back to for a moment. I saw some questions come through in the question box that were related to the vaccination of all staff, and if the center is completely remote, then do they have to have people vaccinated? I want to steer clear completely of the public health orders because I'm not sure I entirely grasp them. It's not in my area of expertise. But what I do want to just raise here when I see questions like that is that again, given that All Center Letter 2104 requirements there still continue to apply, that means that that it should be a very, very rare experience that we have where a center is not having contact with participants at all. So for example, one of the requirements in 2104 is for reassessments and assessments and evaluations to be done and to be done by the MDT members. And again, all that detail is in the All Center Letter 2104. So those assessments would be by sort of default or by the expected way of doing those would be in person. So we have said in our frequently asked questions document that by exception, if there are documented reasons why a provider cannot get a participant to the center to do a reassessment or evaluation, or to get those done in person in the participants' homes, then those would be allowed remotely. But there's no sort of like, how to describe it. When I saw the question come in, I think it was stated in a way that, well, all we're doing is remote. So again, I would question, is there no one at the center that is capable of doing the remotes on the team? I mean, capable of doing the reassessments and assessments and evaluations of the team members. None of the participants that are safe for that. That it's a little bit of a stretch to imagine that. If it's the case, then that flexibility exists. But again, given that we're moving back in the direction to the extent that it's safe and having the expectations that that MDT members are getting eyes on staff, eyes on participants, and getting those assessments done, it would seem a rare thing to be having absolutely nothing happening in person. So I'll leave the question, the answer to the question to our CDPH experts about what about those staff members who have absolutely zero chance of contact with participants. We'll leave that to them to answer. But again, I wanted to just address that because the takeaway here message around previous guidance under 2104, All Center Letter 2104, is that all the other requirements continue to apply while we pause that October 31 date for everyone to be back in the center at least one day per week. All right, I hope that that is very clear. All right, we can move on to the next slide, whoever's running the slides. And let's talk about some ongoing vision team activities. The operative word here is ongoing. So as Miss Liddy always says in her ALE web talks, she always reminds everyone that the vision team has been busy at work. We've been busy at work since March of 2020. We rebranded ourselves from being the crisis team back then, the beginning of this public health emergency, to the vision team. And for good reason, because we wanted to start shifting our work as we got accustomed to some of the policies under TAS, and we were doing ongoing training and addressing those ongoing needs. But there was other work to do with this transition back to center services, and so we have been still busy working every week, hour and a half to 3 hours. Sometimes we meet twice a week. Often we have homework in between, meaning we're continuing to follow up on work that we're developing with regards to trainings that that ALE so wonderfully provides every other week, and policy refinements and information sharing and development, et cetera. So, so that's been ongoing. So our purpose continues, and that is the twofold purpose of this vision team to proactively respond to the public health emergency, helping everybody navigate this time, and planning for the future. CBAS, there's a lot of things that we have called it, but let's just stick with CBAS 2.0 for now anyways. Looking to the future, building on lessons we've been learning during this temporary alternative services period, and working on recommendations to remove barriers for the program for ADHD CBAS, to help with meeting master plan on aging goals, and specifically some initiatives that are in there for the next couple of years, and other state initiative goals, namely CalAIM and home community-based services, those in the areas of improving access, reducing healthcare disparities, increasing choice, bringing services to where people are, services and supports. So some just takeaways from all this. We've been talking about this. We want to remind you that many of us have been busy sort of dealing with the immediate, present, and looking ahead to future things that need to get done here. And so we're going to continue to meet regularly. We also meet with our managed care plan partners regularly, and we have a quarterly meeting for the managed care plans who are on this call here. We have our CDA quarterly meeting with all of you next week on the 26th of August. I believe it's in the morning. Jill can confirm that. And we're going to talk about these new requirements, and including we're going to be requesting your input for changes to remote services. What things need to be done to ensure that we're making clear what the expectations are for ensuring that participants' needs are met at this time when they're delivered remotely. A couple other things we're looking at. Again, Jill mentioned the 1115 waiver. That's where the CBAS program lives, so to speak, where the authority comes from the federal government to provide CBAS and for them to pay part of it. And so she mentioned the end of the public comment period. I want to also just mention that Department of Healthcare Services sent the waiver to CMS with a request to amend the waiver to allow for flexibility for provision of reimbursement of remote services for CBAS enrolled participants under specified emergency conditions. So this is different, to be clear, different from what we've been doing and have been approved to do during the public health emergency. So if approved, CDA and DHCS will be working with stakeholders, managed care plans, the vision team, all of you, to develop standards for those flexible services. So again, to be clear, that's different from the flexibilities that have been approved under TAS, but very important development that will be for CBAS program going forward if that is approved by CMS, because as we know, and Jill alluded to just moments ago, there are plenty of public emergencies going on and personal emergencies that people have where there is an interruption to their ability to receive the services they need in the centers, and a great role that the providers can play in bringing services to those participants where they are. So all of this is by way of just making sure that everybody knows what's going on behind the scenes and what's coming in the front of the scenes here very shortly with this postponement of that big deadline that you've all been working toward. We don't want any surprises out there, but we also want to emphasize the message that we are moving forward, and that we hope that that as all of you, but especially providers, take this this time to meet the requirements of the new public health orders, and to get your centers, your staff ready to go, your buildings ready to go, that you are ready and ramping up for the next phases when they come. And as soon as we know that, we will be sharing it with all of you. So I think that's all I have to share. I see there's a lot of questions that have come in. So I don't know, Jill, if you wanna toss me some of them, or we can both field them together. Dealer's choice.
Yeah, thank you, Denise. Yeah, certainly some questions come in. I think I'm just looking at kind of a few seem to come in at the same time. This has to do with our centers required to do in-person assessments at this time, or if participants are refusing to do, or if a family or participant does not want to do a reassessment in person, is it okay to do it remotely? And I think we had previously stated in some guidance that we had put out that, you know, that in general assessments and reassessments should be completed in person, but you know that, you know, certainly there are exceptions if the participants are fearful, do not, or are refusing, or do not want to participate in an in-person assessment or reassessment at this time. So definitely exceptions to that as needed.
Yeah, and Jill, I hope I didn't hit that too hard in that messaging, but emphasizing, I think, the importance of ensuring that providers are not hearing that they're completely going back to sort of beginning days of the pandemic, where their doors are shut and all they're doing is meeting the minimum task rules of being available 6 hours a day and doing exclusively remote. That is not, I think, what anybody's expecting at this time. I think that the expectation is that we're marching forward. That's why we're getting all your staff ensuring that they're vaccinated, having evidence of that, and positioning those staff members to be able to do things in person, again, as it's appropriate and safe, and as participants are willing. You know, participants always have the right to refuse things. But again, I wanted to make sure that we weren't giving the misimpression that that's you know, all bets are off. This is a pause for that October 31 deadline, but the other expectations stay in place.
Okay. We had another question come in. This has come up before as well. If there's been any change for mandatory participant vaccination, or is it still the same? Is it up to the individual? And we could answer that the participants are not required, cannot be mandated to get the vaccine as far as its individual choice. Certainly, they cannot be required to get a vaccine. And I think that is outlined, and I'm not sure of the source. I don't know if that's in one of the public health orders or not, or if I'm thinking of something else, but it may be an AFL that might have gone out from public health regarding that. Another question was, a lot of these questions are coming in, and, you know, we're looking through them too, and apologize. A lot of them are really kind of pertain to public health orders, and again, really fall under the purview of our something that we would need to defer to our public health colleagues to answer, but we'll see what we can get to. One question is, will the new ACL give us clear direction on how to bring people back to the center safely, including how to include transportation?
Yeah, so this is when we've had some conversations with our vision team members. Again, I think you know, some major themes, obviously, that all of us are repeating is a great deal of uncertainty for all of us. Have to have some humility about this. So I guess first of all, we do expect some guidance out from the Department of Public Health at some point regarding this program and some of these issues, some additional guidance. And I guess the other part of that is that the safety issues, getting participants back safely. So I think that there's nobody who's going to tell you there's zero risk of getting people back in center and means of transporting them and whatnot. I think that there's an emphasis, at least in our all center letter, on the center making determinations, again, based on individual conditions with their participants, the level of vaccination that they have among their participants, the ability to accommodate them safely in the center at this time, meaning to be able to space people and keep maintain their spacing, the ability for people to wear masks, those participants keeping masks on and wearing them properly. So a lot of those determinations are necessarily subjective. And so at least for CDA's part right now, I think we're trying to acknowledge that the centers are going to need to make a lot of judgment calls based on where their community is, the center participants, and their ability to keep people safely spaced, maintain those distances, maintain masking, and to conduct activities in ways that are going to be appropriate at that time. So there's a lot that we're basically saying is in the provider's court at this point to make decisions about.
Mhm.
I'm going to call out this question, Jill. If evaluations have been completed with the October return date in mind, will a second evaluation need to be conducted now with the postponed date? So I guess I would say to this one, this is I guess it's a challenge to answer with one sort of cookie cutter answer, one answer that applies to all. So if you had individuals who were expecting to be back in the center in October, and now that's not possible at your center, then the evaluations, of course, are ongoing, and with ongoing sort of week to week and day to day things that go on in normal times, and including under tasks, you would be making decisions and making chart notes about what's happening with that individual if they are not going back in center. But again, if you've completed them and they were planning on returning by October, and the center can still provide those services to those individuals and they're ready and willing to come back, then there's no reason not to bring them back if that is the case. So in that case, you would be developing from day to day as they return and as their needs dictate. I think this is probably going to be something that we also will continue to talk about with our vision team members and talk about getting more sort of guidance from the, sharing stories from the other providers as to how they're handling these things as well.
Yeah, Denise, I think that's a good point. Just to reiterate what you said too. If participants are willing and able to come to the center right now, and the centers are able to provide those services, safely, and that there is no reason, that needs to pause. That should continue. So, just want to reiterate, there's no directive here that is telling anyone to stop providing in-center services. But certainly that what we anticipate that the postponement of the deadline of October 31st is just that it allows for temporary pause if needed for providers and participants. But certainly in-center services should continue to the extent that you're able to safely provide those, and to the extent that participants are able and willing to attend.
Another thing I think that I would share, just based on sort of some of the general tenor of some of these questions, a lot of them are just not, they're really for Department of Public Health, but as far as some of the requirements that or clarification that we have yet to see from Public Health regarding ADHD CBASH practices, I wanted to just mention that there's a lot that's been sort of left to the imagination. We're still with the 6 feet distance. We're still with the masking. And there is best practice, and then there's sort of meeting the mandates or meeting the requirements. And so I just want to emphasize, when it comes to things like how often and when would you be testing participants, and how would you deal with very specific issues around screening of participants, et cetera. What do those things look like? Some of the detail has yet to come from the Department of Public Health, if it does. And I guess, there has been a lot of conversation on the Vision Team and ALE Web Talks that have been taking place about best practices in this area, what other providers are doing to maintain that safe environment, ensuring screening via the telephone before participants' days of attendance, screening before anyone comes into the building, looking at temperatures, et cetera. And yesterday we saw on the ALE Web Talk, we saw questions coming in as to, well, what's an acceptable range of temperatures? And so again, we would have to defer those to our public health experts. But the point is, I think that the centers need to develop protocols for doing this and ensuring to the best of their abilities, making good faith effort to conduct that screening, making sure that when someone has been exposed, participants or staff, that you take the precautions with regards to ensuring there's no further spread and that they get cleared for COVID prior to returning. So again, more guidance we hope coming out soon from public health on these matters. But in the meanwhile, I think there's best practices that you can be following, that your provider community has been sharing a lot of information about, and best to go towards lean towards the best practice rather than meeting the minimum mandates.
I see another question came in regarding on-site surveys. And for the on-site survey, will the CDA advise their staff surveyor be requesting the participant to come into the center to interview in person? So I would say, Vic, I think for any type, just as in any regular on-site surveys that we do, if a participant is not there that day, we would perhaps follow up with them by phone or some other means, but we would not be requiring them or requesting them to come in. Again, it's not a regularly scheduled day that they're in attendance. So, but we are, again, knowing that, the on-site surveys may require some different planning on our part. Over the next several months, we'll be taking a look at that too, to see, again, making sure that they're conducted safely and with the needs of the participants in mind as well.
I see one here, Jill, that's a pretty easy get, and that is, can OT and PT be done remotely? Yes, it has been approved all along. That was part of the original TAS approval, that PT and OT can be done remotely. And to many of the challenges of doing that, I can't speak, but I know that that we have heard again from providers all along throughout this public health emergency that the PTs and OTs have been involved, of course, with assessments and reassessments, ongoing care planning, training of caregivers, training of staff to conduct Zoom exercise classes, et cetera. So there's been a lot that's been going on with our OTs and PTs all along, and we would anticipate that that since the April 21, also another 2104 was issued, that the PTs and OTs have become more involved, and as more people have been vaccinated, more people have returned to the center, more staff. That their participation in services has just been growing all along. So yes, that's been approved since the very beginning.
Okay, so the next question, one of the questions is we're very limited in how many people can come to the center at a time. Is that number going to increase? And we're assuming that the limitation again is probably based on the 6 foot distancing and such really at this point. So again, that will kind of have to defer to that's guidance that we're waiting on, hoping that will be released by Department of Public Health to give some more guidance regarding facility based requirements for participant attendance and how many and the 6 foot distancing and such.
I would add that to the extent that that air quality and temperatures allow the ability to move programming outside, it is there, and we could encourage that as perhaps a more safe way to deliver services, better ventilation outside. That's also an option for our centers that have outdoor space. All of you should have some amount of outdoor space available.
Just taking a look at some of the rest of these questions. Some of them we haven't addressed because we just really can't answer. More the purview of our public health partners. If they indeed have an answer at this time, because we know many questions may just can't be answered right now. One question let me answer to came in about incident reports and reporting COVID-19. So we had submitted previously submitted reports and we're told we do not need to do it anymore since we do not have participants at the center. So let me clarify too. The guidance had been released previously about submitting incident reports, and the direction was that you would submit incident reports for positive reports of COVID in the event in the situation where the participant was being served in person in their home or in person at the center. So there is more. That guidance is on our CDA website. So if you take a look at that, that would certainly, again, give you some clear direction on when you need to submit the incident reports pertaining to COVID-19 and positive cases. But that really, the reporting pertains to if there's a positive case of a participant who is being served in person at the center or in person at their home.
I'm seeing a question about somebody echoing my zero risk comment. Of course, there's no way to get to zero risk with anything in life, but just the question being that how could the center address this? Will there be a standard risk waiver form for participants to sign to release center's liability? You know, all the different providers and centers have different ways of bringing participants into programs and having them sign enrollment documents, et cetera. But one of the required forms is the participation agreement, where you are getting basically consent from the participant to receive services. Now, during TAS, the CDA had announced that we waived that form because it wasn't making as much sense because many people were not getting those services, participants getting services in the center. But as you bring participants back, we have not gotten any further guidance out about participation agreements at this point, but you can anticipate that those will be required again as participants are attending the center. So to that question, the participants are consenting for services, and if the centers choose to add any additional language to that form, that's their choice, or to have any riders or attachments. But again, I think that waiving risk is a sticky legal question that we wouldn't wade into, but definitely the participation agreements are something that you might consider being a vehicle for making sure everyone has communicated. You as the provider communicated with the participant and family member about how the services are going to take place, et cetera. So I wanted to get that one. So it looks like somebody was on a webinar or somewhere where our colleagues at social services had said no more than 50% capacity. That hasn't been anything that's come out. If anything like that were to come out, it would come out of the Department of Public Health, and we have not seen that or have anticipated that. So that's not something that applies to adult day healthcare or CBAS centers, but certainly the square footage of the facilities, the the layout of the facilities dictate the provider's ability to keep the participants safely distanced from one another. Somebody's asking a question about documentation here that's fairly, I think, straightforward, if I understand it. For PT and OT treatment, if the participant refuses the in-person treatment, could we put participant refuses on a flow sheet? So as far as, again, I'd stress participant rights are that they may refuse any treatment. So a refuse is something that, that we have seen and would see on flow sheets and in notes, et cetera. At some point, if there's nothing but refusals, there are questions that need to be asked by the multidisciplinary team. Is the service appropriate for the participant? What's the reason for refusing? All of those things. But again, those are sort of standard things during normal times. During these times, clearly there's going to be participants who are not going to be wanting services in center at this time. So a service that is scheduled should be appropriate. And when it's not able to be delivered, an R for refusal or some other additional notes clarifying why would be called for.
I think one question there about any changes in quarterly notes requirements. So documentation that was addressed in ACL 2104, I think Denise had talked about that earlier, that we're still moving forward with the guidance in ACL 2104, which says that each MDT member conducting assessments and reassessments and quarterly progress notes, will complete their own documentation. So just keeping in mind, but again, that's an ACL 2104 where we reference that. I don't know quite what you mean by changes in quarterly note requirements, but I should say that every discipline that is conducting their own assessments, reassessments, and such, providing care should be completing their own quarterly notes at this time.
Read this one. Thank you to your colleague Diane Puckett for reminding us at the web talk yesterday that she said that the antigen test kits are available over the counter through CVS. It's one of the things that the good Dr. Siegel told us to address the testing prior to receiving your test kits through the state testing program. So you can purchase them over the counter. I purchased some just for personal reasons over through Amazon. So they're available a lot of places, the Binax kits and others. And then she also addressed vaccination for pregnant staff members. So definitely encourage you to check in on that web talk and information that's available on the CDC website. There's also another one here that to a couple of them regarding the MDT. Does a speech therapist have to be part of an MDT? Speech therapy is part of the required services under ADHD CVAS as it is needed by participants. So whenever you have the need to bring the additional team members onto your team for assessment because of the need of the participant, whether that's a behavioral therapist, a dietitian, registered dietitian, speech therapist, they become part of the MDT. So that is driven by participant needs. Then next one, just to double check, kind of CBAS staffing, social worker, social assistant, RN, PD, be able to do remote services on days that no participants are served inside the center during a transition. Again, depending on the appropriateness, the safety, that levels and the preparedness of the providers and the participants, the expectation is that centers will serve participants in the center as that's appropriate and serve remote as needed. And so if there's a day where if a center chooses to operate for this time, have their doors open 2 days a week for in-center to a limited number of participants, and then on other days of the week provide remote on the same days that's going on. These things can happen concurrently. So I hope that answers that question.
Okay, and thank you, Danielle, for putting the link to the CADS, the ALE web talk that was hosted yesterday. Wonderful, thank you. Yeah, we recommend that everyone take a listen in on that if you weren't able to attend. Lots of helpful information from Dr. Siegel at Department of Public Health. Taking a look through some of these, if we can answer them right now. Some of them we may pass on and maybe follow up with you directly at a later time. And some of these, again, like we're saying, we're just not able to answer.
So I'll just go ahead and jump in here on this one and just read it as a comment. The CBAS Center experienced a positive case with vaccinated CBAS participants that came to the center for in-person services. That has happened. It seems that this will be a recurring possibility on an ongoing basis for months to come. It seems necessary for CDA and DHCS to consider a hybrid model in person and telehealth TAS approach to providing CBAS for the long term. So I want to clarify something I said earlier there. So comment noted, and I think that one of the things I was talking about earlier was the state's request. Actually, it's still up on the slide here that I was where I was talking about it, with regards to the request under CalAIM for approval for the state to move forward with defining conditions for continuing flexibility of the CBAS program. And again, separate from the public health emergency that addresses personal emergencies and community emergencies, et cetera. So that's something we're going to be working on. That's different from what we're doing right now with TAS, but we hope that it's going to fill some gaps if we get approved, fill some gaps with those emergent needs. I think that to the extent I can clarify this much, that this is for participants who are CBAS enrolled participants who either had been attending, have interruptions to their attendance, or can only attend partially, et cetera. So these are things that we're going to be sort of hammering out with our partners over the coming weeks and months if we're approved. So to that commenter, that's something that is being considered. But again, it's for CBAS participants who are attached to the center, and not just for exclusively sort of remote services. That's a whole different thing, and something that the state is working on with enhanced care management. So. Looks like we're getting a lot of these answered behind the scenes. That's great. I don't see anything else, Jill, that I feel like I can tackle.
Let's see here. Yeah, I think we may have exhausted all that we are able to answer at this point today.
Yeah, actually, there's one comment here that just came in about I think it would be helpful if there were more guidelines provided for, I'm assuming, for safety for in-center, rather than leaving it up to each center. And noted, I think that this is something that we're going to be, again, we anticipate some Department of Public Health guidance coming out with some more specific sort of requirements and mandates and some recommendations. And I think that this is something that your colleagues at CADS and provider colleagues and ALE will be developing training on and working on to establish some clearer sort of considerations and decision points, but it is necessarily something that we have been wanting to leave to the centers at this point until we have further guidance.
Okay, and
Oh, never mind. Hit the wrong button there.
just another note, someone had put a question about the food program. Will be expiring on September 30, 2021 for remote meal services. Will it be extended accordingly? So don't know. I'm sorry, can't answer that question. That may be coming from our partners at the Department of Education who oversee the food program. Don't quote me on that. I could be wrong, but sorry, I can't answer that one. A couple more questions coming in here. We're just taking a look at them. Just okay, thanks, Diane. Diane put in there that regarding the food program, reapplication for the next year is taking place right now. Like we probably should reinforce too, your colleagues and partners and fellow providers out there are a great resource for information too, definitely. So I encourage you all to questions again to reach out to fellow providers who may know. Also, just a quick reminder again, if some questions we see coming in related to a lot of questions about testing, vaccination requirements for staffing, et cetera. A lot of that information is in the public health orders that were released and in the AFL from public health. So again, encourage you, if you haven't taken a look at those, please do so. You may find some of the answers to those questions in those documents. Golrees, I think you see a question come in about new admissions, asking about the difference between admitting a complete new participant who has never been receiving services. So, yeah, kind of gonna guess what you might be asking there for, but again, we do note that in ACL 2104 for new participants too, that any new participant not previously served in the center prior to the public health emergency should be those requirements for admission, like the physician's history and physical, home assessment, TB screening, those all must be completed prior to receiving services in the center. So and again, at this time, there is not the requirement that they have to receive services in the center as a new participant. New participants, if you're enrolling them, can and receive remote services. So I'm not sure if that answers your question, but if not, feel free to follow up with an email to us. Okay. I think we're going to have to stop there, Denise, unless you see any other questions or we can tackle.
I don't. I see a lot of familiar names. Just want to say hi.
Yeah.
Hi, Golrees. Haven't seen her name in a while. It's good to be here with everybody, and I'm glad we could answer as many questions as we did. And thank you to the people who thanked us here. Very nice. So yeah, nothing further at this time. We're going to get that all center letter out as soon as we can, and we hope we've alleviated some stress today and maybe even helped with some confusion.
Yeah. Definitely. And thank you, everyone, for, again, all the good work that you continue to do and the service to the participants around the state. We know that, again, it's still, we are still in some challenging times and with new challenges in front of us every day. So, but thank you again. Appreciate you all being here on the webinar today with us, and keep a lookout for the forthcoming ACL, and I will likely have some more webinars or trainings in the near future. I'll just take us to just a reminder that part of this, there's some resources here for all of you, and these are all hyperlinks. Again, we'll be sending out the PowerPoint for today's presentation, so you'll be able to access those resources through those hyperlinks. But some good information there, especially, again, information regarding masking, if you have questions about that, public health guidance for the use of face coverings. Lots of different resources. We know it can be sort of information overload, certainly feeling that ourselves some days. But we hope this has helped you a little bit, maybe answered some questions like Denise says, and we are here definitely. If you have additional ones, please send that to us, send us an email, and we'll get back to you as soon as we can. So until we talk again, hope all of you have a wonderful evening. Stay safe, be well, and we look forward to meeting with you again soon on a future webinar. Thanks, everybody, and have a good evening.
Thanks.